Welcome everyone to this explainer. Look, when someone collapses from extreme heat, the difference between life and death literally comes down to the immediate clinical actions taken by the people standing right next to them. We are not just talking about a mild case of getting too hot. This is a profound physiological crisis. By the time we wrap up today, my goal is to equip you with the precise scientific understanding and the emergency medical protocols you need to act as a highly capable first responder. You're going to know exactly what is failing inside the human body, how to accurately diagnose it right on the spot, and how to intervene effectively until the paramedics arrive.
Okay, let's dive into this. We're going to cover three distinct clinical phases today. First, the anatomy of thermoregulatory failure. Second, diagnosing the clinical symptoms. And third, emergency medical protocols.
Part 1. Anatomy of thermoregulatory failure. Basically, how the body's cooling system completely breaks down. At the very heart of a heat stroke is a scientific concept known as thermoregulatory failure. You can think of the hypothalamus, which is located deep inside the brain, as your body's internal biological thermostat. Normally, it perfectly balances heat production with heat loss to maintain homeostasis, our stable internal operating environment. But during a heat stroke, that highly tuned regulatory center gets utterly overwhelmed. It essentially breaks down. The hypothalamus completely loses its ability to control heat loss, meaning your body is absorbing or generating heat way faster than it can possibly expel it. The thermostat doesn't just malfunction, it literally turns off. And when that internal thermostat fails, we hit a critical clinical threshold, 104 degrees Fahrenheit or 40 degrees Celsius. This is the exact number you've got to remember. Once the core body temperature spikes above this marker, we are no longer dealing with heat exhaustion. We've officially entered a life-threatening medical emergency. At 104 degrees and above, the internal heat is so intensely high that cellular damage can actually begin to occur. The body's natural cooling mechanisms have entirely collapsed.
And this brilliantly illustrates exactly how we get pushed over that 104-degree threshold. Thermoregulatory failure doesn't happen in a vacuum. It's triggered by very specific environmental and behavioral factors. Prolonged exposure to extreme environmental heat is obviously the primary catalyst, but then you add physical exertion. Strenuous activity or heavy exercise in hot weather generates massive amounts of internal metabolic heat. Toss dehydration into the mix, and if there's inadequate fluid intake, your body simply doesn't have the water required to produce sweat. You are literally drying out your primary cooling mechanism. Finally, tight garments. Wearing heavy clothing traps whatever heat is being generated and stops sweat from evaporating. When you combine all these factors, the hypothalamus really stands no chance.
Let's move to part 2 and see how this builds. Diagnosing the clinical symptoms and taking you from a bystander to a first responder.
Now, what's really interesting about this is a crucial medical distinction that frequently confuses untrained bystanders. We actually have two distinct clinical presentations of altered sweating. In classic heat stroke, which often affects the elderly or folks stuck in dangerously hot environments for days, the patient presents with anhidrosis. That means hot, dry skin, where the body has entirely given up on sweating. But contrast that with exertional heat stroke, which typically strikes athletes or laborers working incredibly hard in the heat. In that case, the patient might actually present with diaphoresis, meaning heavy, active sweating. Because they were just exerting themselves, their skin may still be totally wet, but their internal temperature has still dangerously surpassed that 104-degree mark. So you absolutely cannot rely on dry skin alone to diagnose this crisis.
Beyond the skin, you must look for the signs of a cascading systemic failure. A heat stroke is a profound neurological and physiological crisis. The absolute red flag here is an altered mental state. Because the brain is physically overheating, the patient is going to display confusion, agitation, slurred speech, delirium, or even active seizures. Physically, you're going to observe tachypnea, which is rapid, shallow respiration as the lungs desperately try to offload that heat. You'll also find tachycardia, a racing heartbeat, significantly increased as the heart works in absolute overdrive to pump blood to the skin to cool the body down. They might also complain of a severe throbbing headache, feeling sick to their stomach, or actively vomiting. If you see this combination of an altered mental state with these physical distress signals, a heat stroke is actively happening right in front of you.
Let's jump into Part 3, Emergency Medical Protocols. Immediate triage and intervention. In medicine, we always say time is tissue, so let's act. Protocol Step 1, and this is an absolute, non-negotiable first directive. Call emergency services immediately. You do not wait to see if they feel better. You do not try to fix this entirely on your own.
Thermoregulatory failure of this magnitude requires intravenous fluids, advanced temperature monitoring, and trained medical professionals. You initiate the 911 call, you get dispatch on the line, and only then do you proceed to field triage.
While you wait for the paramedics, your sole clinical objective is rapid temperature reduction. Just run through this emergency checklist quickly. 1. Move the patient immediately out of the environmental trigger. Get them into an air-conditioned room or at least a shady spot. 2. Cool the skin. Douse the person with cool water, apply wet cloths, or literally just spray them down with a garden hose. 3. Target the major blood vessels. Apply ice packs directly to the neck, the armpits, and the groin areas. The extreme heat causes vasodilation, bringing massive blood flow right to the skin surface, so slapping ice on these major pulse points rapidly cools that high volume of blood as it circulates. 4. Circulate the air. Fan air aggressively over the patient. This accelerates evaporative cooling, which basically mimics the physiological sweating process their body can currently no longer perform.
So the crucial point here is hydration safety. I know it's purely instinctual to want to pour water down the throat of someone suffering from the heat, but you must adhere to this critical safety warning. You have to restrict hydration based on their neurological state. Offer cool water only if the person is fully conscious and able to swallow. If they are confused, delirious, or having a seizure, their gag reflex is compromised. Forcing fluids can cause them to aspirate, drawing water straight into their lungs and creating a secondary fatal airway emergency. Just don't do it.
Now, as you are executing these cooling steps, the emergency dispatcher is going to need specific, real-time data from you to prepare the arriving medics. Use this mental checklist to communicate clearly. Condition. Tell them the patient's neurological state right now. Are they conscious, confused, or totally unconscious? Location. Give them an exact assessment of where you are. Are you stuck outdoors in direct sun, or have you moved them indoors? Resources. What clinical tools do you currently have at your disposal? Tell dispatch if you have ice, running water, or a fan actively working on the patient. This kind of concise, professional handoff ensures the medical team knows exactly what they are walking into.
We've covered the critical science, the absolute breaking down of the internal thermostat, and we've walked through the immediate, clinical steps of cooling the body and managing the patient. Heatstroke does not afford us the luxury of time. It demands immediate, decisive medical intervention. So I'm going to leave you with this final thought. If someone's hypothalamus fails right next to you today, are you prepared to act?